Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We get to it's an intro to Dr. Michael DeFRANCO, who is a board-certified orthopedic surgeon who's calling now, and he does things to help people. And so I like to have a diverse show, and this is the why we bring people in, whether they're medical professionals or they're human beings just living the life. And someone like Dr. DeFRANCO, can absolutely make a difference in someone's life so that they can go on. So thank you for being on our show, Dr. DeFRANCO.
My pleasure, Anita. Thank you.
Yeah, and I don't have to tell you this, but when you see people limping and coming into your office and they're having such a hard time, nothing is happy for them, and all of a sudden you give them hope, and your experience says, look, if you just do what we say, maybe in another month you're going to be like new. Is that what you tell them?
Yes, we try to. We try to give them hope that we can intervene in some way to make them happier. I had a mentor in my training that said, moving is part of being happy, and actually not only part of being happy, but also being healthy. So when somebody has a joint that's painful or their back is painful and they can't do or enjoy activities of daily living, or they can't go out and do things with their spouse or their kids or their grandkids, or they can't work and enjoy their job on a day-to-day basis, that can be very frustrating and really affect not only your mental capacity but also your physical capabilities. And so as orthopedic surgeons, we have the privilege of addressing those issues for people and try to give them non-operative treatment options, and in certain cases, when it's indicated, surgery to help them overcome their pain and improve their function.
So, Dr. DeFRANCO, when, and I know people ask you this all the time, when is the right decision for them to stop suffering and to have replacement?
For joint replacement, typically, the most common joint replacements that are done are in the hip and the knee, and then in the shoulder too. There are also ankle replacements that are done, and certain parts of the spine are being replaced now as well. So, the appropriate time for that, and again, it's typically individualized to the patient, but in a general scenario, if somebody develops knee arthritis, the first steps in management would typically be non-operative. So the patient would come into an office, we'd get a history for them, get a better understanding of how much pain and dysfunction they're having because of their knee arthritis, and then discuss some appropriate non-operative treatment options. And for most patients, a trial of non-operative treatment is very important, because there are a lot of people who have arthritis in their knee and then they never need surgery. So to just operate on everybody automatically who has knee arthritis or arthritis in any joint would be inappropriate. A lot of people would probably be getting surgery that's not indicated. So the initial step is to try to offer non-operative treatment options, and then if those fail and the patient is still not happy and their pain is still there and interfering with their function day to day, then surgery becomes an option.
The orthopedic surgeons, or let's just say the whole profession, has really come a long way. I don't know. You sound young. I don't know how old you are, but you don't have to spill the beans. But let's just go back 70 years. What were they doing?
70 years ago, compared to today, it would probably seem like we were in the dark ages. Replacement and post-operative care from surgery. Again, joint replacement is a great example. Compared to 70 years ago, we now have a lot. Technology has really changed the way that we do joint replacements. Now we use preoperative imaging to understand the patient's joints and alignments a lot better, and to help us develop implants that are specific to patients. We have computer navigation in the operating room to make sure that the cuts that we are doing and the implants that we are putting in are in the appropriate position so that they don't fail early for the patient. And even in terms of post-operative care, 10, 15 years ago, patients after a total joint replacement used to stay in the hospital for a week or maybe more. That could be considered routine. And today, people are getting their joints replaced. They're up and walking the same day of surgery, and at some centers around the country, they go home the same day. So it's been a very remarkable evolution in terms of how we care for patients with joint arthritis and patients who get joint replacements.
I remember, Dr. DeFRANCO, that wheelchairs, that was the solution. You can't walk anymore, plop into a wheelchair.
For some patients, yes. I mean, when even before the age of joint replacements, it was almost to the point where you would say, well, we try to control your pain with the limited resources we have, and it was almost as if you came to the decision with the patient that, hey, this is something you're going to have to live with. And that's, from an orthopedic standpoint, that's very frustrating because you want to help a patient get back to their life, to a life that they enjoy. And, there aren't, people who, if they're confined to a wheelchair, if they're used to being active and then they're confined to a wheelchair, again, that can be very frustrating and limiting for them and oftentimes results in unhappiness.
Well, Dr. Michael DeFRANCO is our guest. He's a board-certified orthopedic surgeon with Broward Health. Are you at the Imperial Point? Is that where you do your work?
Yes, I do. I work out of there. I'm in a private office off-site from their campus where I see patients, but I do surgery at Imperial Point, yes.
And I think Coral Springs, too. Broward Health, Coral Springs?
Yes, I'm on staff there as well.
Yeah. It's a wonderful organization, Broward Health. I'm actually on the foundation board, so I'm very aware of what people like you do to keep our hospitals top of the line. And it's really extraordinary. And
Broward Health system is remarkable in the terms of the resources that they have available to the community. Not only, a lot of times we think about patients in the community or people in the community have a problem and say, hey, we have to fix that problem. But a big part of today's medical care is really preventive medicine, or what can we be doing to prevent some of these problems in orthopedics that we're seeing. And I think the Broward Health System has really done a remarkable job of developing resources for the community, not only to be educated about these resources that they have, but getting doctors out to promote them.
That's an excellent idea. Let's talk more about prevention. I think that, it's not that, the physicians, of course, even though they're there to do the very difficult surgeries, if they thought they could take a patient who's having problems and through exercise or other means could prevent them from having some of this very serious surgery, I know that you'd like to do it. What would you say to someone who came in and they're having a problem? I mean, do you have particular... I know you deal in sports injuries. What's your advice for people to be able to stay as sharp and healthy as they can?
Well, let's, as an example, just to take a very common problem these days that we see in the media every day, and it's something that I think all of us struggle with, is our weight. And we hear in the news how obesity is such a problem. And obesity just happens to be an issue that is central to the care that a lot of orthopedics develop, because the heavier you are, it puts more stress on your joints, specifically your hips and your knees, and that can contribute to all kinds of stress across those joints. And so as we look at preventive measures for that issue, again, it's a sensitive topic because it's very difficult to lose weight, and it can be very frustrating if you don't have the right understanding about how to do that. And I think that's where Broward Health comes in, and they have a lot of resources there, dietitians, therapists, doctors who can evaluate and provide resources to help the patient understand the appropriate ways to go about that. Specifically, among males, they have something that's called the man van, which they have similar resources for women, but they happen to have this mobile van that goes around and allows men to be assessed in terms of getting some lab values done and looking at their weight and providing some very basic education about how to improve their overall health, including their weight. So that's just one example. Obesity and weight loss, something that seems like a simple topic, can be very complex, and with the right understanding and education from the health professionals and the resources available through Broward Health, that people can develop a better understanding and help prevent problems that go along with obesity.
That's excellent. But I wanted to ask you something. I know that a lot of people have gone to their gyms and they're trying to lose weight and, of course, exercise. And inevitably, someone either falls off a machine or they trip or something happens and they wind up with problems that they didn't have when they first got there.
Yeah, I'm probably one of those patients. One of those people that happened to. Those are embarrassing moments when you're at the gym and you're clumsy, but those can often result in injury. And this is an issue that we see not only in adults but across the country in young people who are adolescents who are trying to get into the gym and get fit for their particular sport, whether they're on a competitive team or just they're a recreational athlete. People oftentimes have good intentions of going to the gym, trying to do a lot of exercise. But the issue with that sometimes is if you're not used to going to the gym or you've never had any training, and you go to the gym and you start either getting on a fitness machine or you start lifting weights, and you don't have the proper understanding about how to do it correctly, that could put stress on your body that can oftentimes result in injury. So for those people who are interested in going to the gym, simple advice, either find somebody that you know who understands how to exercise, or a lot of these gyms have trainers there who can teach you the proper technique or develop an appropriate exercise program for you. To go to the gym and say, hey, I've had a New Year's resolution and I'm starting January 2nd, I'm going to go run 8 miles at the gym. That might not be the best thing for you if you've never run before. It may be worthwhile to take a class or two to understand proper running technique and get on a gradual running program that would bring you up to 8 miles instead of trying to do it all on January 2nd and then spending the rest of the week in bed because your legs are so sore.
Yeah, good advice, and I hope people listen to that. And it's funny. I used to ride bikes, and I stopped riding bikes because I found myself, tripping, falling over something, and injuries as one ages, they don't heal as quickly. So I guess you have to think about what is the best exercise. I wanted to pursue something with you, though, when you think about being as an orthopedic surgeon. There's so many new things coming out now. I don't know if you're dealing in stem cells or any of these kinds of the pain relievers that are not, they're kind of cutting edge, as they say. Are you involved in that in any way?
I am. There are a lot of things that are out there. We hear about them in the news again. Stem cells, platelet-rich plasma, which we refer to as PRP. So I think it's important when people hear these things and they're interested in talking to their doctor about them to have a discussion about what is the science behind this. Is there evidence to support their use? Is there evidence to say this actually makes a difference long-term in treating the specific problem? So, we have patients with all kinds of musculoskeletal issues in an orthopedic office, and stem cells are out there. They've shown some great potential. PRP is out there, and it's shown some great potential. But if something doesn't have very good science behind it, and it hasn't been proven yet, first of all, many insurance companies aren't paying for it yet. They're not reimbursing. So a lot of this becomes out of pocket. But the other issue is that if you can't tell a patient that this definitely is going to make a difference long term, or you don't know definitively that it's going to provide any benefit, I find it difficult to say it's even worthwhile to try it or to give it to them until we know definitively that it's going to help them. So a lot of people will ask me about this in my office, and I have that honest conversation with them. And I think they appreciate that honesty, and once they receive that education, they realize that even though that's an option in some offices, if they want to pay out of pocket for it, it may not be the best thing for them because it still seems a lot of these things are in what we would say the experimental phase.
That's fair. That's being a very good physician and giving them all the options. Of course, even now with the internet, people look up everything, and you spend more time just answering questions. But I also wanted to ask you, years ago, when someone reached maybe 80s, even 90s, and they needed hip surgery or knee surgery, it was like, why? What for? But now, what's the age of your oldest patient that you've ever performed surgery on like that?
Well, I've had a couple patients 100, and I've had a couple
You're kidding.
Over 100. No, and when I was in residency, yeah. So, and when I was in training at the Cleveland Clinic, we had several patients that we were doing joint replacements on who were over 100 or over. So, again, I think the point here is that some people have the misconception that, I may be too old for surgery, and they're suffering with their pain. And again, as we get older, everybody develops health problems. So, surgery may not be indicated in everybody. And health problems outside of your orthopedic issues may preclude you from having surgery. But in people, as we were discussing before, being active is part of being healthy. You know, if you have to sit in a wheelchair all day or you have to lay in bed all day because of knee or hip pain, that can decondition your body. That can lead to all kinds of health problems. You can get a blood clot in your leg. You could get pneumonia. So as we get older, it's important to stay mobile. And so patients in their 80s, 70s, 80s, 90s, and, in some cases, if you're 100 and you're very active, in some patients it is indicated to help them continue moving and help them to continue enjoying life.
Well, I'm so glad you said that. I like you already, and that's very important because you don't know probably much about me, but I actually am a gerontologist, and I have always told people, I wrote a book called Live to be 100 Plus, along with my husband, and my husband's 90.
I'll have to read that.
I'll send you one. No, I'll send it to you. My husband's 91, and he has had, over the last 25, 30 years, he's had total knee replacements. He's had 4 hips at one time for another, and you can't stop him. I mean, he's in great shape. So I'm one of your, best, promoters of what you're talking about. I think it's really, just as you said, it really depends on, and also though, knowing, of course, as one ages, it's a lot harder to recover from anesthesia. So do you do spinal blocks when you're performing surgery?
Yes, that is, that's a very, very valuable resource that we have, the anesthesiologists who are able to provide blocks to patients, because in some cases it can be the healthier choice rather than undergoing a general anesthetic. So spinal blocks, there are various types of blocks that they can use that would help the patient avoid a general anesthetic, and that can be a very good pain reliever and help the patient recover from surgery a little bit better than from a general anesthetic.
Right, and it's amazing to me, something you said before, that someone can get up that same day, go home. I mean, I remember it used to be at least 3 days, but...
Yes, it really is amazing when you think back on it. I remember when I first started my training at the Cleveland Clinic, that was the total joint replacement service was one of the busiest services in the hospital there, and so as an intern and a junior resident, we used to take care of a lot of those patients who would spend several days, 4 or 5 days in the hospital after surgery. But now at some centers, they are moving to get these patients home, and I think we've developed better resources in terms of home care and pain control post-operatively that allow us to do that. And it's really to the benefit of the patient. Most patients, and most people, I think, would tell you they're more comfortable in their home environment than they would be in a hospital. They probably tell you that the food is a lot better at their home than in the hospital, depending on what hospital you're at.
Right, depending on who's cooking at home.
Yeah, that's true. That's true.
But they still need lots of rehab.
Yes, they still have. You're right. They still need rehab, but again, if we can make them comfortable and get them home, they can start to either get that at home or provide the resources for them to go to a facility instead of keeping them in the hospital for a prolonged period of time.
So when someone is, you've done all this surgery on them, and now you're wanting them to stand on that very surgery that you've just done. So are they pretty well medicated?
In some cases, yes. It's a delicate balance because you don't. First of all, with the pain medication after surgery, you don't want to interfere with their ability to breathe, and you don't want to interfere with their ability to balance and to maintain muscular control over parts of their body. Because if they get too much pain medication and they get dizzy, or their balance is off, they're at increased risk of fall. And you certainly don't want somebody who just went through a joint replacement to fall and get a broken bone that would compromise their outcome long-term from their joint replacement or prolong their recovery. So we try to provide adequate pain control that allows them to get up right away and move. Patients, they're a little bit apprehensive at first because it's the concept of, I just had this huge surgery. Are you able to get up and walk on my leg?
Right.
But with some encouragement, they actually, most patients will say it actually feels good to get out of bed and stand and move on it. So once they're up and moving, most patients like that, and they're eager to get up even more each day that goes by after surgery.
And I'm sure that it varies depending on what the physical condition of the person is in. So I thought that it would be very good for someone to get in, if they're going to have an operation like this, and if it's not too painful, they could certainly get themselves ready. I mean, do upper body exercise and do everything they can to be able to be prepared to recuperate.
Yes, I think you're right about that. Being conditioned and in some physically fit before surgery probably helps afterwards because we always say that muscle strength is very important to walking and moving around. Cardiovascular fitness is important in terms of overall conditioning. So the problem that people run into, specifically for lower extremity arthritis or joint pain in the hip, the knee, or the ankle, you will commonly hear that people say, I want to exercise, but I can't because I'm in so much pain. And again, that's difficult for people. We try to say for those patients, well, they can try the non-weight-bearing exercises where they might be an exercise bike or a pool. For people who get into a pool, it's a great exercise because the buoyancy of the water can help take stress off their joints, but they can still exercise those muscles that they need to walk and to stay physically fit. So some people find themselves in a bind because their arthritis gets so bad that it's really decreasing their ability to move around. There are some options, like I said, riding a bike or getting on an elliptical machine or swimming, but in severe cases, that's not an option, and you wind up proceeding with surgery. And again, once that arthritis is out of there, the patient's feeling much better, then they can get on with their rehab and get back into shape.
So how long now, when someone today has a knee replacement or hip replacement, can they consider it's going to stay with them 30 years, 40? I mean, used to be it was like they used to say 10, 12, but I heard the statistics are way beyond that now.
Yes, and I think that's really reflective of the advanced technology. We seem every year to be improving our ability to not only put these prosthetics, the implants in, but also improve the quality of the implant. So this is not only true for the knee and the hip, but also for the shoulder, which is less common in the hip or the knee. But we're the technology, the imaging technology that we can do preoperatively, and some of the computer systems that are available to help us make certain cuts in the operating room are really providing us with a much better ability to put these implants in where they should be. And then the implants that are going into place, we're making those better, so they're lasting longer. So these are very good operations, and they've had very good success. And, there's always an honest conversation with the patient preoperatively about complications that can occur. So these, unfortunately, that's just the nature of surgery. When you do a surgery and you put a joint replacement in somebody, things can happen after the surgery. It can get infected, and some people, their bone quality might not be that great, and the components can loosen. Accidents happen all the time. People can get a joint replacement and fall and get a broken bone around the implant. But in most cases, this is a very successful operation. And again, the nature of our research and the advancements in our technology have really benefited the clinical outcomes that patients are experiencing long-term who have joint replacements.
Well, you sound very enthusiastic. I always love enthusiastic physicians. And so my guest is Dr. Michael DeFRANCO. He's a board-certified orthopedic surgeon. out there at Broward Health, and it's Imperial Point and also Carl Springs. If you'd like to make an appointment with him, remember this is Pencil Talk Radio. Let me give you that phone number, 954-771-3334. Again, that's 954-771-3334. I'm Anita Finley, as you know, and this is the Boomer Times radio show. And by the way, I wanted everybody to know that Imperial Point has been winning some really great awards. One thing that they have, and they're very proud of, is they have a certain kind of of excellence with their nurses. And I know that Dr. DeFRANCO would say, wow, that nurse, you probably have a nurse that deals, once you do your operation, that nurse goes in then and carries out all your orders.
Yeah, well, the nurses there are really spectacular, not only in their knowledge, in their skill level, and their experience, but on a whole nother personal level. They're just very friendly, warm people. And as people, doctors and nurses, of course, we are all there to help patients, to say, you have a problem, we want you to get over your problem. We have the resources to help you get over your problem. But I think what sets a lot of the nurses apart at Imperial Point is them going beyond and getting to know the patient and saying, hey, we're just not here to take care of your problem, that we care about you and we care about your family. And it's very important when somebody's in the hospital receiving care in the emergency room to communicate not only with the patient who was there to receive care, but also with their family. It can be very stressful to have somebody who is in the hospital or has an injury or who needs surgery. And the nurses there do a spectacular job about communicating and making the patients feel comfortable at a time that can create a lot of anxiety and nervousness as they're receiving care and recovering from their conditions.
Yeah, that's so true. I'm going to the Broward Health Ball tonight. I don't know if you are, but it's a pretty important thing to do because that's how we raise money so that people like Dr. DeFRANCO have the right facilities to practice in, and that everything he just said, it's a matter of money and making sure that the latest cutting-edge equipment is there and that the personnel's happy and the hospitals are right, have all the latest equipment. So we hope that. Are you going tonight?
Anita, unfortunately, I'm not, and I'm not sure if this would be inappropriate or not. But the reason is my wife and I weren't able to find a babysitter, so I don't know if I should ask listeners to call if anyone's available to babysit.
That's very interesting. Where do you live?
I'm joking, Anita, but
I do
think that I do think it's important. It's a very important event. Again, it's
right.
Intended to raise money for the foundation, which again provides many valuable resources to the community. So
I thought I was going to get to meet you. I'll have to meet you personally in another time. Well, we've run out of money, but it's funny. Someone like you, it's so great to talk with you. I know people don't realize Dr. DeFRANCO and I have never spoken before, but when I get these articulate, well-educated, enthusiastic physicians, it's easy. So thank you, Dr. DeFRANCO. I really appreciate your getting up this morning.
My pleasure, Anita. Have a great day.
All right, bye.